The Affordable Care Act has been really, really beneficial to both Lily and I. Lily qualified for services already, but as her sole caregiver, I did not have insurance when we first moved here. So the Affordable Care Act allowed me to get insurance. Eventually, I qualified for Medi-Cal, so we both have Medi-Cal. But as her sole caregiver, if I didn't have health insurance, my health would suffer. Therefore, she wouldn't have the care that she needs. It's really important that we're both healthy in order for her to have a beneficial life, for us to have a healthy family, and that's my biggest concern. Also, the piece of the autism is now covered through Medi-Cal. So the behavioral services, what happens to those services? There's just a lot of concern. She's made great progress, so we would suffer greatly if those things were taken away.
My son, now that he's going to be 20, when he hit 16, 17, 18, he had to get medication to help his hypertension and depression, a lot of things that go on with autism. He needs that medical, he needs the benefits, and he needs GGRC that's been with Isaiah for since he was 3, and that services helps him for, he's living independently. He has a social worker's been with him since he was little, and that's important to have that support. Or I noticed on that paper was talking about doctors and therapy and all kinds of things that these children need. Now that my son's an adult, he would be lost. He would actually be institution, and he would be walking the streets, and I don't want that to happen. So we really need to have these benefits. We need to keep these programs going. I can't see my son being lost in the system. It's very important to keep these benefits, and it would be devastating for the community and for anyone that has special needs and anybody that needs these services.
If they repeal the ACA, then they will cut funding to Medi-Cal, which is huge for us because Evan is on in-home supportive services and I am his provider, so that is one aspect that's really helpful for us. And then also Evan is very specialized, so one of the things with Medi-Cal is that you can opt out of the managed healthcare plan, and he has just broad spectrum Medi-Cal, and it really helps pick up a lot of stuff that private insurance isn't willing to take.
We knew that he had sickle cell disease before he was born. It was, again, confirmed after he was born that yes, he had sickle cell disease. That's all because of newborn screening. Newborn screening has only happened within the last 20-25 years. He had a stroke at 9 months of age. We didn't know whether or not he would walk. But not too long after that, maybe by the time he was a year and a month, he started walking. And so all of the treatment that he's had in the last few years since the Affordable Care Act was passed is because of the Affordable Care Act. He had to have his spleen removed. That surgery was covered in part by private insurance, but also because of the Affordable Care Act. Because of the stroke, he's had to have physical therapy. He walks with a decided limp. He is not strong on his right side, and so the physical therapy has helped. So it's really taken a child that could be severely affected by the stroke that he had as a baby and made it doable. He's able to go to school, he's able to learn, he's able to write, he's able to ride a bicycle, for heaven's sakes. Now we get into this possibility of dismantling the ESEA, Elementary Secondary Education Act. And that has been a lifesaver for her because we had teachers coming to the home when she was 3 years old. She was able to go to preschool. She can read, write, she can speak, she can make her needs known. Without that special education, without the one-on-one aid that she's had for all of her school life, without the program that we think she's going into now, she's ready to leave high school, and without a school-to-work transition program, all of that is part of IDEA. And we're concerned, the family's concerned, the autism support group that I work with in West LA, all of us are concerned of what will happen to our children without the safeguards and the protections of those laws. Our kids are so vulnerable. There's so much that they have to do without. There's so much that their parents have to do without. Please don't take anything else away from us.